What's wrong with the medical system and the way illness is treated today?
Well, I mean, there's a lot of miracles and amazing achievements to the credit of Western medicine, but at the same time, its purview is very narrow. So it ignores scientific realities. And this is what's frustrating about it. I'm not talking about clever insights or ancient wisdom. I'm talking about science, which is largely bypassed by medical practice. And what I'm talking about is the unshakable, inextricable, ineluctable unity of mind and body, so that our physiology is inseparable from conception, from our emotional environment and our emotional states. So a lot of illnesses, chronic illnesses, autoimmune diseases, malignancy, for sure all mental illnesses, addictions, whatever we're talking about, has got a huge emotional component. And our emotions happen in interaction with other people and in the setting of a culture and a whole society. So essentially, illness in a particular organ manifests not just pathology of that particular body part, but a whole set of life relationships of that individual. So for example, an obvious example, children whose parents are stressed are much more likely to have asthma. And that's been demonstrated for decades. And the physiology of how parental stress causes asthma in a child is very clear and straightforward. But most doctors don't know that. They just give the medications, appropriately so, for the asthma, but they don't look at the emotional environment, which could be very important in healing the child. Or in the United States, Black women, the more experiences of racism they have to endure, the higher the risk of asthma. Or women with severe symptoms of post-traumatic stress disorder have double the risk of ovarian cancer. And the milder their PTSD symptoms, the less their risk for cancer. So clearly, and that's just a small example of how emotions affect physiology and of the mind-body unity that Western medicine ignores.